At the moment you've got a situation where quite a few of the doctors might have a smartphone that they'll have acquired personally, and typically an iPhone. Nurses won't have anything, so they're very much the underserved population here, and that's really a big missed opportunity for the NHS, because they are a mobile workforce by definition, even if they're based in a hospital. Many of them work outside of hospitals these days, into patients' homes, into community clinics and so on. So they really need mobile technology, and typically they haven't been getting provided with that so far.
Where I currently work, we do have the standard call bell systems, and like the demonstrator said, a buzzer goes off. It tells you the number of the bed, which is an improvement on the old style, but it won't go off until you go down. And so you are constantly having a noise, you're constantly having to go and see what's happening, and nobody knows who's gone to answer it, or, and so you could end up with nobody for 10 minutes or two people, a bit like buses, I suppose.
I love the idea of the Ascom Myco. Any device that can centralise the alerting that's necessary for a nurse to monitor their patient cohort in their wards, fantastic. So whether it's a patient clicking their nurse call button, or whether it's a lab result coming in, or it's an X-ray coming in, anything where you can alert the nurse straight away and they can look up and see which patient within the bay, and then respond to that is a fantastic idea, and it just helps to make sure that those priorities are managed and monitored on the ward. So I think it's great.
I think the way that it brings the information to the caregivers at the bed space, and they don't have to leave the patient bays to go and find out what the alarms are for. And I think from my experience, I know that there's alarms constantly going off in some wards when I visit, and they are being ignored, not because the nurses think there's nothing wrong, but because they've got that alarm fatigue. And that's what first attracted me to come and look at the stand.
It's the first device custom built that I've seen for this kind of alerting and notification. Yeah, definitely. There are other applications out there which kind of look after the nursing administrative functions and do some sort of monitoring of Muse scores, etc. But this is the first one I've seen that's kind of got the Apple Touch kind of UI feel to it. It looks very easy, simple to use.
I think that we often think that staff are reluctant to use technology. I think that's incorrect. I think most people these days have a smartphone. We use it in our daily lives, so why shouldn't we use it to keep our patients safe and look after patients in the hospital environment? We can tell them acute care. I think the same goes for out in the community as well. So I don't see why we shouldn't be using technology the same as we do in our everyday lives, such as banking and booking your holidays.
Nurses do more and more paperwork, don't they? More and more documentation. Every day there's something else that they've got to do. If this can lessen some of that load, then fantastic.